On behalf of Migraine Canada, I'm Wendy Gerhardt, and I'm happy to be hosting this with Susan Cape this evening. And I'm just going to share a little bit of information about Migraine Canada, do brief introductions, and then pass it over to Susan for the presentation that you tuned in for. I just want to recognize our supporters. Without these supporters, the various webinars that we are able to hold and the resources that we're able to develop wouldn't be possible. So I just want to quickly recognize them. Today, as I just mentioned, just a brief overview of Migraine Canada. Susan Cape is going to talk to us a little bit about migraine and mental health, regaining control over your life post-migraine. And then, of course, open it up to your questions and answers. Who we are. Migraine Canada is a new organization. It was inaugurated in 2018, so we're very new. Much to my chagrin, when I joined Migraine Canada, who I would thought that there would have been an organization like 25 years in the making supporting patients, to learn it was 2 years old, I was hugely shocked and in dismay that there hadn't been something long-term to support patients. And you might, as I talk, you might sense a bit of eagerness in me trying to catch up for lost time and supporting the community. We are federally registered as a not-for-profit organization. We are seeking our charitable status. Our board, we are led by a board of volunteer individuals comprised of individuals living with migraine and also some healthcare professionals who dedicate a lot of their time to support the community and really try to build this organization. I represent the organization as their executive director, and we have several volunteers who really help pave the path to making things happen in the background and bringing incredible programs and resources to the community. Very quickly, I'll just go into, our mission is really to improve the lives of Canadians with migraine and other headache disorders through five pillars, actually: awareness, support, education, advocacy, and research. And again, here are our strategic pillars. I'm not going to go into depth. We will be posting a shortened version of our strategic plan on our website shortly. So I encourage you to visit that and learn more about really where our focuses and our efforts are being set to support the community. Very briefly, call to action. Please, if you've not already signed our petition, to join our growing community, please do so. It's available off of our homepage of our website. And really with that brings you your name into our petition that gives me the ability to represent a larger voice of Canadians living with migraine and headache conditions. And it also gives you the opportunity to receive updates on new information on our website, the new events that are happening, and that kind of thing. So I encourage you to become a part of our community. We don't have a membership, so this per se is really our membership, and we do want to make sure that it's growing and we're meeting the needs of the community. And I just encourage you to watch our website for more of our webinar series as we launch them. We are planning to hold, kind of one per month over the course of 2021, with the exception of the summer months, where we hope you're out enjoying some nice time with family and friends, maybe depending on COVID. But we're definitely planning to hold regular webinars. So they will be posted as we confirm details on our website. And just as a disclaimer, we provide information, not medical advice. The information presented and discussed might not apply to your own medical situation. Always discuss medical treatments with your own healthcare provider who knows your medical history. And this is also related to sort of the mental health piece that Susan's going to talk a bit about with regard to mental health. So always have that conversation with your healthcare provider. And with that, I'm just going to briefly introduce Susan. So Susan Cape is a second-year PhD student at McMaster University in the School of Social Work. She received her SSW diploma from Mohawk College in 2004 after working in the social service field for many years. Completed a BA in Human Services from Athabasca University in 2016 and an MA in Gender Studies and Feminist Research from McMaster University before pursuing doctoral studies. While Susan has worked in various nonprofit environments, she spent most of her career working in women's services in the area of addiction and mental health. Her therapeutic training in trauma, informed care, and feminist counseling has led her to question traditional forms of service delivery informed by the medical model, which she has been foundational to her research and practice. Susan now operates her own private practice in Hamilton community and developed facilities, a local support group for migraine patients. And with that, I will turn it over to Susan to take us. Thank you, Susan.
No problem. I'm just gonna share my slides here. Hopefully this works. Okay, everyone can see that?
Yep.
Okay. Excellent. So thank you for that introduction. I just want to thank Migraine Canada for inviting me to speak tonight. If I'm looking down, it's because I write things out as if it's a conference presentation. It's just how I often do these things. But I wanted to talk just a little bit, do an intro. Sorry, this is not, there we go. Just wanted to do a bit of an introduction because I'm speaking to you today, not just as a researcher and not as a social service worker, but as someone who's been struggling with chronic migraine for close to 16 years myself. And for at least 14 of those 16 years, and in connection to my migraines, I've also been struggling with various emotional challenges, which have been clinically defined by my physician and allied health professionals like social workers, using various labels and diagnoses such as generalized anxiety disorder and social anxiety disorder, obsessive compulsive disorder, health anxiety disorder, dysthymia, depression, agoraphobia, and panic disorder. And while I might at different times experience symptoms of these many disorders, I've always been a bit troubled by our need to label feelings, behaviors, and reactions in this fashion. And I'm also troubled by the idea that I have so much disorder, because when I really lay it out there like that, like I just did, does that make sense? Do I actually have all of these disorders? I don't know, but I'd like to think that I don't actually have every disorder that makes up all the mood disorder section in the DSM, because that's just a little ridiculous to me. So the reality is I experienced quite suddenly in my mid-20s symptoms that often left me somewhat disabled by vertigo and visual disturbances, nausea, and in later years, pain. And these symptoms had no warning, and they usually occurred spontaneously. They impacted my career and my education, my family, my marriage, and my friendships. Sorry, I have a dog who's barking. And these symptoms dictated what I could and couldn't eat and couldn't drink, what activities I couldn't take part in anymore, and often left me feeling really alone and isolated. So over time, I went from being a young woman who felt healthy and confident and extroverted and strong to someone whose life was completely derailed by feelings of consistent shame and guilt and chronic fatigue, anxiety, and introversion, which I'm sure some of you have experienced yourself. So while on the surface, I might legitimately fit the bill as someone who's suffering from concurrent mental health disorders, it became clear to me over the years that what I was and still am suffering from are the effects of trauma. And so experiencing a traumatic event is something that has a significant impact on our minds and our bodies. And trauma is really subjective. So what is traumatic for some is not traumatic for other people. And our ability to work through traumatic experiences greatly depends on how we've been socialized, our genetic predispositions, access to resources and supports. And in general terms, people often associate trauma with war veterans or people who have experienced significant harm. So we think of those war stories. But trauma has no boundaries. The effects and symptoms of trauma often occurs in those who have experienced illness that has significantly impacted their day-to-day life, or that has caused them to fear something in their day-to-day life. And the spontaneity and disability of migraine attacks definitely conditions a certain level of fear in a lot of patients. So as I move through this talk, you'll notice me trying to get away from the medical model of mental health a little bit as much as I can. And that's not to discount it as a valid explanation for categorizing mental distress. I think for some people, it can be a really useful tool, and it's how we understand mental health and mental illness, but it doesn't mean it's not without its flaws. So in my practice, I tend to use a feminist lens to guide in how I view and work with those experiencing mental health challenges. So instead of viewing those challenges in clinical terms as illness, which denotes that there's some kind of problem with you as an individual, I prefer to view emotional states, all emotional states, including the uncomfortable ones, such as anxiety and panic, sadness, frustration, low mood, as resulting from social, environmental, and systemic sources. So what that means is that emotions are normal, and human beings are supposed to have a varied repertoire of emotions given different circumstances and situations. That's how we're built. That's how our brains are wired. So your feelings are valid, all feelings, and emotional states result from the reactions and interactions our bodies and minds have with the world around us. So what that means is that when human beings experience something we find disabling or disturbing or out of our control, we react, and that's normal. It's normal that we have reactions to things that we find uncomfortable. And sometimes those reactions can impact us in ways that are just as disabling as our migraines. So things like panic attacks are definitely extremely disabling in addition to the migraine. So while the medical model of care around mental illness is quite prescriptive, and it has a set of diagnoses, it's focused on how your doctor sees your problem. My approach to mental health focuses more on trying to understand how somebody is experiencing a problem. So how does that problem actually come to be? And what do they need to do in order to improve their functioning? So I spent a long time being told that I have this disorder and that disorder, and if I were to only take this pill or that pill, I'd be okay, that I'd be happier. And all it did was invalidate my experience as a woman who had, as far as I was concerned, gone to hell and back. They knew my symptom profile. They knew I was working and a student and a wife, and that I was trying to get through life feeling like garbage all the time. And of course I was anxious. Of course I had panic attacks. I don't think that's disorder. I think that's a normal response to a body, my body, deteriorating and having very little support, no time for rest, no space or resources to address my symptoms. I had to work, and I had to make money, and I had to live. And my disability and those societal expectations were completely at odds. Which is why I've chosen to focus my research on looking for ways we can make institutional change. So tonight, I'm going to ask you to shift your thinking away a bit from I have a disorder, which can be sometimes self-limiting and disabling in itself. And I want to focus more on our feelings and our reactions to those feelings that naturally come from experiencing what I would categorize as a traumatic event. So the purpose of my talk tonight is to highlight a couple of things. Number one, that the link between migraine and mental health distress is really, really strong. So in particular, if you're struggling with symptoms associated with anxiety or depression, you're not alone. Many, many migraineurs struggle with mental health challenges. And so this talk will hopefully provide some insight as to why that might be. And the second thing that I want to highlight and go over with you are ways that you can cope with these feelings and sensations. So I'm going to give you some concrete tools, but only a snapshot because we obviously don't have a ton of time. But there's many different strategies that you can use to manage mental health distress. And hopefully these start giving you some ideas. So number one, what is the link? Mood disorders, specifically anxiety and depression, are frequently experienced by migraine patients. So some studies have cited depression and anxiety disorders to be as high as 2 to 10 times more prevalent among migraineurs compared to the general population. However, this number is really, really hard to pin down for a lot of reasons. Overall, significant emotional distress experienced by migraine patients is most likely higher than what is reflected in most studies, if not all. If someone has chronic migraine, I would be very surprised if they didn't experience some type of anxiety or depression or mood dysregulation associated with those symptoms. Every migraine patient that I've spoken to who's had chronic symptoms struggles with those things, but not everybody reports, not everybody speaks to their physician about this. So that's why sometimes it's really, really hard to narrow down in these studies. Management of migraine and migraine symptoms becomes really complicated by co-occurring disorders, and it's often really difficult to understand what disorder is cause or consequence because they're really biodirectional. There's biodirectional features of both disorders. So that means migraines can cause one to feel symptoms of anxiety or depression, and or anxiety and depression can trigger the onset of migraine. So it's really unclear if there's a third factor as well that might influence or cause both conditions to happen. So for example, hormone imbalances or nutritional deficiencies can affect both mental health issues and can cause migraines. It can also be really difficult to differentiate between some migraine and mood disorder symptoms, as there tends to be quite a bit of overlap between them. For example, when I get migraine aura, I flush and I feel uneasy and my heart rate increases and I feel really dizzy. And these symptoms also occur when my anxiety response is triggered by something I fear, like speaking in front of a large audience. But alternatively, low mood and withdrawal from daily activities, social supports, and aversion to light and dietary changes, such as eating more or less, are common symptoms associated with depression. But they're also really common symptoms that are associated with migraine. So what does all this mean? It means that some patients, it's not always clear what came first, the chicken or the egg. It also means that there's a lot of ambiguity here in regards to how we define what constitutes a mental health disorder for migraine patients. So I know in my case, I never struggled before with anxious feelings prior to my migraines becoming chronic. My anxiety grew out of the fact that I went misdiagnosed for well over a year, nearly 2. And I had a particularly difficult time managing my symptoms in everyday life. So I felt out of control. I thought I was having a stroke every day, and I did all that while forcing myself to work and pretend to be well. And eventually that took a toll on my mind and body because I could not keep that up. But how does anxiety and depression post-migraine come to be if it happens at all? And there are many explanations for this. Some are biological and some are psychosocial, meaning the cause is rooted in our psychological health and how that interacts with our environment. Because of my background in social service work and feminist theory, I tend to focus my attention there on the psychosocial realm. However, realistically, it's probably a bit of both. So in terms of biology, I don't want to go too far down this rabbit hole because I could do an entire talk about this alone. But from a neurobiological standpoint, our brains are always subject to change. So neuroplasticity speaks to this. It's a term that speaks to the ability of your brain to form and reorganize synaptic connections in response to new learning or injury. And so I've already discussed a bit about how our minds and our bodies might internalize an event or events, such as having repeated migraine attacks as traumatic. The result of this internalized trauma might affect us in different ways. So I want to give you an example of how biology, behavior, and environment all play a role in how anxiety responses might develop over time after migraine occurs. And this is only one explanation of many. But there is a really famous experiment, a very unethical by today's standards experiment that was done in the early 1900s called the Little Albert experiment. And it's conducted by a behaviorist named John B. Watson and was an extension of the work by Ivan Pavlov's work on classical conditioning. Many of you have heard of Pavlov's dog. And Watson wanted to demonstrate that an emotionally stable child could be conditioned to develop a phobia. So what he did was, him and his research assistant had Albert, who had been exposed to several furry animals prior with no sign of phobia, sit close to a small rat that he could touch and play with. And every time Albert reached out to pet the rat, Watson would create a loud banging noise behind him. And so Albert responded by crying out in fear. And this pairing of Albert attempting to play with the furry animal and the loud noise continued until every time Albert was presented with a furry animal, even in the absence of the noise, he would cry out in distress. So what this experiment tells us is that we can be conditioned to have anxious responses given the right set of conditions. So classical conditioning is one way this can play out, and in ways that we don't even notice. So for example, I had never in my life feared going to a grocery store. It wasn't until my migraines became frequent that I began to experience attacks in the grocery store almost every time that I went shopping. And I'm not sure if it was the fluorescent lights or the busyness or the smells, or if it was just pure coincidence. But over time, my migraine attacks would happen in these grocery stores, and it made me fear the grocery store so much that for several months, there was a period in my life where I made my husband do all the shopping. I just refused to go. And my fear also became attached to public transportation and walking my dog by myself more than 15 minutes from my house. I began to have anxiety responses when exercising after a few cardio sessions resulted in migraine attacks. So I started to develop all of these associations with activities that never used to cause me distress and that used to be pretty normal. And so while these associations sound irrational, and they serve a purpose, our brain makes these connections in order to keep us safe. So sometimes too safe. So while neuroplasticity means my brain most likely made physical changes in response to these experiences, this new learning in the form of synaptic connections, I also developed behavioral changes and perceptual changes. So trauma conditions us in several different ways. For example, some people develop obsessive compulsive behaviors because they feel they keep them safe. Some people might isolate themselves or avoid people and places that aggravate their anxiety. And once we have these anxious avoiding behaviors, it can be very difficult to get rid of them. But keep in mind, all of these changes, whether biological, behavioral, emotional, resulted from new learning and experiences that conditioned you a particular way. So that means you can change it. You can make new connections. You can condition yourself in ways that put you back in control simply through learning and experience. And I know I make that sound super easy, and it's not easy. It takes a lot of work and time and dedication. But hopefully we can talk a little bit about what management looks like so it can start you down that road. So managing distressing mental health symptoms that accompany your migraines might take on a lot of different forms. And while medication therapy that treats both issues is certainly an option that you can speak to your doctor about, I want to focus on strategies that anybody can learn to use either on their own or in combination with medication. So as mentioned earlier, although I'm discussing these treatment options mainly as they relate to addressing mental health symptoms, some of these strategies can also be used to decrease the severity of migraine attacks. Cognitive behavioral therapy is the one I'm going to start with. And they've actually shown through some recent studies, I've read some papers that have talked about how CBT has really helped patients manage and cope with their migraine symptoms. So let's start there. Cognitive behavioral therapy, so CBT, is a process to teaching, coaching, and reinforcing positive behaviors. CBT helps people to identify thoughts and emotions that are linked with behaviors. So this approach is based on the idea that our thoughts and behaviors reinforce certain emotional states. For example, as I continued to avoid grocery shopping and I continually told myself that if I walk into a grocery store, I will have a migraine attack. This reinforced all of those anxious feelings that I was having. And it didn't only impact me emotionally when I found myself having to enter anxiety-provoking spaces such as the grocery store, but at times I truly believed that the anxiety triggered some of the migraine attacks as well. So some of the basic principles of CBT are our thoughts affect our behavior and emotions. Once we are aware of our thoughts, they can be monitored and altered, and emotional change can be achieved by altering our thoughts and behaviors. So in CBT, it's really understood that many of our issues are caused by negative automatic thoughts centered around how we view ourselves and others and our future. And so for those with depression, this might manifest as a negative view of yourself, and your beliefs might be associated with helplessness, failure, incompetence, or unlovability. And for those of you with anxiety, thoughts tend to focus on the overestimation of a physical threat. Core beliefs are linked to things like risk and dangerousness and uncontrollability. So techniques in CBT for addressing and working to change those automatic thoughts generally requires a trained professional to help work through various processes and set goals. However, there are strategies used in CBT that you can certainly practice on your own. So the first technique requires you to have a bit of a conversation with yourself. So writing in a journal can be a really wonderful tool for identifying thoughts associated with stressful situations. And the technique would be to practice journaling on a day-to-day basis in order to describe events that cause you distress and identify any thoughts and behaviors that accompany that distress. So the CBT work comes from reviewing journal entries after writing them in an attempt to look at your thoughts objectively and make an attempt to problem solve through the situation differently. And so this might require you to identify problematic thoughts and think of alternative ways of thinking about the situation. For those of you who like more structure, this is an example of a thought record, which is something we commonly use in CBT. And it helps people to identify more clearly thought patterns that are associated with certain feelings and behaviors. So the challenge isn't just about identifying these things, but to come up with alternative ways of thinking about the situation. So it's really about a process of changing your perception around something. Another technique useful in addressing both anxiety and depression associated with your migraines could be through a technique called present activity scheduling. So this is where you would come up with an individual plan of activities that you could do that take 10 minutes or less on a day-to-day basis, and you simply do those things. So for me, I like to focus on small tasks that provide a sense of accomplishment, that get me to engage in exercise. And the point is that over time, engaging in small activities that promote positive emotions will affect the other areas of your life where you're struggling. Something that really helped me both personally and as a clinician, there's a little book called the CBT Journal for Dummies. It's one of those books for dummies. It's a structured, accessible CBT workbook. I like that it's in layman's terms, and it goes through various exercises on a daily basis for about 12 weeks. And it's a way you can do this type of work self-directed, so you can do it on your own. But CBT isn't for everybody. It requires a lot of homework. You need to write a lot of stuff down, and that's not necessarily for everybody. So, that said, let's move on to grounding techniques. So there are lots of different meditation strategies that might be helpful for managing both emotional responses and in some cases migraine symptoms as well. I'm going to focus on two different techniques that help to reduce sensations associated with intense emotional distress in different ways. So the first one I want to talk about is grounding. So for those who are struggling with increased anxiety or panic, or even feelings of hopelessness that come from depression, grounding can be a really useful tool. So grounding is relatively simple. It can be done anywhere at any time. No one really needs to know that you're doing it. I'm actually kind of doing it right now. So it's a strategy to distract away from and calm intense emotional responses. So things like physically, oh wait, sorry, I was on the right side. Physically, you can do things like running your hands under cold water or putting an ice pack on your neck, carrying an object with you in your pocket that you can touch or hold in times of stress, or engaging in stretching exercises. There are also mental grounding techniques that you can use. These are things that I actually really like. So going through the alphabet and coming up with a name for each letter, like listing as many TV shows or movies as you can, or reading the letters off of a visible sign, book or paper backwards, or counting the tiles on the floor, counting anything really. One of the things that I used to really do a lot is I would get anxious on the subway. So I would count the number of people on the subway car, or I would count the number of empty seats on the subway car, depending on the night or the day. So when I worked still in the nonprofit sector, I'd often have clients come to my office in distress, and sometimes they would be having full-blown panic attacks. And I'd start to ask them random geography and math questions. And at first they'd just look at me like I was crazy, but they'd go with it. And after they started to calm down, they kind of understood what I was doing. So while grounding techniques bring us back to the present moment, it has a reputation for being a technique that is focused on lessening intense feelings and symptoms through distraction. And that doesn't always help. So sometimes, you know, you're in the moment and you're having anxiety and you try to distract. And the fact that the grounding isn't working fast enough might actually make you feel more anxious. So mindfulness is another strategy. And it's about trying to feel present in a given moment and accepting what's happening around you, and doing so without judgment. So regular practice of mindful meditation has been shown to have a significant positive impact on the brain neurologically, and those who practice it tend to feel more at ease with intense emotions and even physical distress. So for years, I struggled with two types of panic. One type of panic was legitimately caused by my anxiety and had very specific triggers. And for those situations, I would ground myself successfully, reminding myself that adrenaline would decrease and all would be well in a few minutes. But then there were other situations, and some of you might relate to this, where I started to get an anxious feeling and it would occur before my migraines would start to happen. So I don't know if any of you have had this before stomach flu or before your migraines, but I had this feeling that something was off, and I might start to pace and feel fidgety, and I don't really know why those feelings are happening. But then migraine aura would set in afterwards and my migraine would follow its normal course. And I have no control over that feeling. It's attached to my migraines, and it doesn't matter how much I ground myself, it goes away in its own time and it feels like. So how do I deal with this? So although it might seem counterintuitive, making peace with those feelings I found was really, really important. And I remember being on a bus on the way to work one day, and my heart started to race and I had that adrenaline feeling in my stomach for no reason. And I tried to ground myself and it just wasn't working. So I flipped the script and I told myself this has happened many times before and nothing bad has ever happened to me outside of feeling uncomfortable. And I focused on my breathing and resisted the urge to think about, worry, clench my body, or control what was happening. And I continually brought myself back to focusing on the sensation of my breath going in and out of my lungs. And when needed, reminded myself of the need to just let go of control, which is really hard to do. So mindful breathing and meditation focuses on staying present in the moment that you're in, and it teaches us to focus on the process of controlling the breath while thoughts are observed at a distance. Not judged, they're just allowed to pass. Mindful meditation emphasis is on letting go of control and embracing the current feeling, even though it feels terrible. And again, this is a strategy that takes practice and time to learn. There's an app called Headspace on Android and Apple that you can access, and they actually go through different types of mindful breathing exercises and meditations. And now they also have a Netflix special called Headspace as well. And I believe they discuss mindful meditation on there if you're more of a visual person. And that brings me to my next slide about exposure therapy. So this one's interesting to me. Exposure therapy is really crucial for those who train themselves to avoid certain situations or places for fear of having anxiety or a migraine attack. So this is really tricky because we train ourselves to avoid triggers, and this can be really useful as a strategy for decreasing migraine attacks, but we can't avoid everything. And we always risk being triggered when we leave our homes. So whether or not I get debilitating migraine depends on various factors, such as how well my meds are working that day and how sensitive my threshold is that day. And there's always someone wearing a lot of perfume or someone who smokes or fluorescent lights, and I can't control these things. So true exposure therapy is generally used for anxiety disorders such as agoraphobia, and typically operates under the principle that the anxiety will be extinguished with increased exposure to stressful situations. But with migraine, it serves a slightly different purpose, and therapy is a bit more involved. And to be honest, I have yet to find a therapist who has or can tailor exposure therapy for those who have chronic relapsing physical conditions that in some people can cause agoraphobic tendencies. I do. And if you know of anyone who does, please maybe write it in the chat or let me know, because this is a really big issue for this community. So the reality is, if we have chronic migraine, we'll experience symptoms in public. They will always be a reality for us. And at times those symptoms are going to be brought on by something going on in our environment, or they might just happen randomly, and they might always feel terrible. So I've had to develop my own take on exposure therapy. And instead of the typical goal of extinguishing uncomfortable symptoms over time, this adaptation focuses on exposures that help us to realize it won't happen every time we engage in a particular activity, which I think was a big fear for me many years ago. And also, even if it does, we can handle it and we can still live our lives and do the things that we want to do. So this is something I struggle with every day. I've had migraine aura on the way to work a few times that resulted in me temporarily losing my eyesight or having severe vertigo. And as a result, I've fallen in public, and I've been walking my dog. It started to happen, and I've had to just sit down on the sidewalk and the curb and just wait for it to pass, despite feeling self-conscious about sitting on the curb in a neighborhood other than my own. I avoided the movies for years because every time I went, I would end up getting nauseous, and I'd get a pounding headache and I'd get vertigo. And so this caused me a lot of anxiety. So what I found that avoidance, though, only made those feelings worse, especially the anxiety. And the more I avoided activities and that triggered my migraines, my anxiety grew and my world became much, much smaller. So exposure therapy taught me that I'm much stronger than I give myself credit for, and it trained me to accept the belief that my migraine and anxiety are symptomatic and that they weren't actually going to cause me any real harm. So while there are traditional techniques associated with traditional exposure therapy, honestly, there's really no best way to do it. You can start small and put boundaries around certain activities to start if you have been avoiding something for a really long time. So for example, when I wanted to start going back to the movies again, I literally just went to the movies and I stood in the lobby for half an hour and just dealt with my feelings of anxiety. And then I gradually started to go to movies during off times when there wouldn't be a lot of people. And I went to shorter movies. And then I just kind of jumped in and said, I'm going to the movies. And if I have a migraine attack or I feel anxious, I'm just going to sit there and I'm going to deal with it. And so I did that with supportive people. And that's how I managed to get through that situation. So this is an area as well that if you have a therapist, it would be helpful to do this with them. However, you can do some of these things on your own. And if you have supportive people in your life that you can reach out to help with this process, then you should. So generally a mixture of exposing ourselves to our fears and taking stock of how our thoughts contribute to how we're feeling and altering them to be more positive and staying present will probably offer us the best results. which brings me to the last point, which is around self-care and defining what is self-care. So I think this is probably one of the most important pieces of recovery. And self-care is basically anything you do in order to be good to yourself. Sorry, I think I missed a couple of slides. It encompasses various practices you engage in that help you to cope with stress, both acutely and preventatively. So by engaging in care practices with yourself, you tend to feel more productive. You have improved resistance to illness and better physical health, and your self-esteem goes up. And you become more self-aware and tend to have healthier relationships. Self-care falls under these 5 categories. And I know often people talk about self-care in terms of things like, I have a bubble bath, or, you know, I like to make sure that I eat a proper diet or exercise. And that's usually how it's discussed. But self-care can also be more challenging. So self-care can be things like setting boundaries and saying no to other people. Self-care can be addressing things that you're doing that might help you self-medicate in the short term, but might cause you problems in the long term. So if you're using substances that aren't good for you, if you are self-medicating with certain behaviors like gambling or sex or other types of addictive behaviors, then those are things that you might need to address in terms of your own self-care. So that accounts for self-care as well. And I also think a really big part of our recovery is to build support. And in order to be resilient, we really need support around us to help us cope and feel safe. So I struggled immensely with the fact that there were no in-person supports for migraine patients. And when I did find a large community online, that was awesome. But I still felt like I was missing a deeper connection with others who could understand what I was dealing with. And I really wanted to develop actual relationships with people that I could see in person and maybe support each other as we tried to get through what was going on. So I started an in-person support group in the Hamilton area, but unfortunately due to COVID, we haven't really been able to meet. We've tried some virtual groups and I'm hoping to try some more, and hopefully we'll get back to that when all of this COVID stuff is over. But in the meantime, if you're interested in connecting with us, we're on Facebook at Migraine Support Hamilton and area. So if you want to stay updated about, you know, whether or not we go back to in-person groups at St. Joe's, that would be a great place to do it. And also in terms of other supports, I started a group on Facebook called Migraine Support Face-to-Face, hoping to take those virtual Zoom support groups more globally. And we're actually having our first support group on Thursday afternoon, if anyone is interested. But also there are various other Facebook groups that are very, very supportive and can help if people want to stay connected. I also want to talk a little bit about counseling and crisis services. And this is more within a Canadian context. But those of you who have a family physician, who see your doctor, they might provide access to a counselor that's covered by your provincial health insurance. So I know in Hamilton, for example, we have the family health team, and usually there's a social worker who works within the family health team that you can be referred to. There's an employee assistant program that many people have under private benefits who also offers counseling services that could be provided to you. And there are some resources I've listed here that are Canadian and Ontario relevant that are also free. And depending on the city or region that you're in, there might be community non-for-profit agencies that offer free counseling and services as well. So I know, example, again, in Hamilton, there is Family Services and Catholic Family Services who offer usually free drop-in counseling. For those of you who are interested in private counseling, I do have a private practice called Mending Minds in Hamilton. However, I'm doing all of my counseling virtually these days over Zoom, and I am licensed to work with anybody in Ontario. So if anyone is interested in connecting with me that way, I've also listed my information. But if you're also looking for a private counselor In Canada and the US, Psychology Today is a really good resource, and they have a great listing of many different therapists that do lots of different types of therapy. And the Ontario Association of Mental Health Professionals also has a really good directory as well. And for those of you who want to stay up to date about my research, I've started an Instagram page called Migraine Scholar Canada. And on this page, I'm posting, my publications. I'm talking about the research process that I'm doing. I'm talking about my journey as a migrainer, trying to do all this stuff and what that's like for me, and how do I manage it? How do I get through it? And also, if anyone just wants to connect after this presentation and have a conversation about anything informally, you could send me a DM through Instagram as well. So I spent a considerable amount of time working in addiction care, like Wendy was saying, and something that's often said in 12-step programs is you're not responsible for your addiction, but you are responsible for your recovery. And that always really sat with me. So I feel that really translates well in our circumstances, that it's not our fault that we have migraines, and it's not our fault that we might develop coping or emotional responses along the way resulting from having to deal with migraine. But I do think it's our responsibility to find ways of working through these challenges as best we can so that we can get the most out of life. And that recovery will look different for different people. It's a very individual process. And I really hope this talk has provided you some useful information that you can take with you as you start your own journey. And that's all I have for tonight. I'm happy to answer any questions.
Great. Thank you very much, Susan.